Hello, my name is Torbjørn Broksten. I'm a consultant obstetrician and gynecologist from the University Hospital of Ullevål, and I would now like to talk to you about bleeding. Now, when I started doing gynecology, I realized that you women, you bleed quite a lot. And bleeding has really been sort of the bread and butter for the gynecologist throughout the years. Now, there's so many ways of treating bleeding, but still there are a lot of women who suffers from this. There are also a lot of women who suffers from quite a lot of pain. You know, the take-home message from this lecture would also be that, listen, you don't have to bleed and you don't really need the pain. And to be quite honest, menstruation as a thing is quite overrated. And from a gynecological viewpoint, women should not menstruate. It's a bit provoking, but still. So, women who have bleeding disturbances can be categorized, and for all of you out there, Americans, they love putting things into different categories. So you can study this slide by yourself. But basically, they have this thing called palm coin, and that's a mnemonic to remember why women bleed. And as you see, there are different reasons for bleeding, like polyps. What's a polyp? Now that's part of the endometrium that makes into a small little bulge, and that bulge might bleed. Adenomyosis, we'll talk about that later on. Leiomyomas, something we'll also talk about, which are benign tumors, and if that tumor is protruding into the uterine cavity, it will definitely cause a bleed. Malignancy now. If you are postmenopausal, meaning that you've stopped your normal menstruations, then a bleed is something that will have to be checked up. So if you have a postmenopausal bleed, you will have to see a gynecologist to see what the reasons are. And of course, it's the sort of normal reason for bleeding, like if you have ovulation and also if you have something wrong with your endometrium. Iatrogenic means that if you have an IUD, especially if you have a copper IUD or a non-hormonal IUD, that would create bleed. I have a lot of colleagues, and indeed actually my wife, who I needed to take the copper IUD out of because it really troubled them with the amount of bleeding. The big treatment for bleeding is also an IUD, which is a hormonal IUD, which we'll talk about a bit later. So, to categorize bleeds for women, we put it into two groups, and we talk about menorrhagia and metrorrhagia. To try to differentiate between those two, menorrhagia is pretty much increased bleeding, which means that you have bleeding for more bleeding than 80 mils per month, or more than 8 days. It's quite common, right? So it's between 15 to 20% of women have this. And as I mentioned, polyps and myomas are often reasons for this, or indeed the IUD, which I talked to you about, usually the copper IUD. Now, the big treatment is the hormonal IUD, right? So that's how to treat it. And in fact, and also tranexamic acid. And there was a conference about 20 years ago where they said that this might be the end of gynecology as we know it, because we have the hormonal IUD and we have the tranexamic acid, and that itself would cure the biggest problems for women when it comes to bleeding. It might also be that we need to do a transcervical treatment, meaning that we can go into the cervix with surgery and remove a polyp, or indeed take away some of the myomas. Metrorrhagia is irregular bleeds, okay? So this might be something that you've all experienced already when you were in your menarche. Menarche is the beginning of your bleeding life. Also, when you come to the menopause, which is the end of your menstrual life, you do get a lot of more irregular bleeds. This is partly to do with that you have anovulatory cycles, meaning that you have cycles without ovulation, okay? This is also something that we would like to treat with an IUD, hormonal IUD preferred. Okay, if you have a lot of bleeds, you will also have to look for infection. infections, okay? So if you have a bad chlamydial infection, it might be because of your, and that might be the reason for your irregular bleeds. And of course, never forget about cancer. So if you have irregular bleeds, it's really rare to get endometrial cancer for young women, but have that in mind as well. So you should send them to a gynecologist, okay? So irregular bleeds are also treated with progesterone pills, and sometimes if women want to get pregnant, of course they do not want to have a hormonal IUD, so you will give them progesterone to try to put them back into a normal cycle. Myomas. So this is a troubled uterus, as you can see. It's got tons of myomas, but I've seen quite a few of these. And these myomas might be difficult, especially for me when I do cesarean section. And we classify the myomas on where they're located in the uterus. So they're benign tumors and quite normal to have. About 70% of the women have these myomas, and indeed women from the African continent have a bit more, and it's not dangerous, and you have to stress this for the women. It's not cancer, even though it's abnormal growth, and 30% have symptoms. The symptoms, it's increased bleed and pain and infertility. So we do get a lot of infertile women, and they have a lot of myomas, and to surgically remove those myomas will increase their fertility chance. It's also quite it's also something that is quite readily a reason for doing hysterectomy, and of course that's not the case if you want the woman to get pregnant, so it might be difficult. It might also be treated with drugs. When it comes to where they're anatomically placed, you see that sort of big satellite up there. That's a myoma that doesn't really do anything, bad for you, but it might be painful. Those myomas that goes into the abdominal cavity, like the one you see in the middle there, that might give you increased bleed, as you might think and experience. Way down towards the cervix, you see a myoma that might even make it difficult for the baby to come out. Okay, so if you have a woman with tons of myomas, you might want them to take a look at our outpatient clinic to see if the baby's head will pass it. Usually it does. The one at the very bottom there is called a birthing myoma, where the myoma is actually passing out of the cervix, and that's easy to twist out and get rid of. Endometriosis, that's sort of a bit of a difficult one, isn't it? It's when you read the Norwegian newspaper these days, it's tons about the endometriosis. It's always the heading where it says the difficult, not talked about disease. I think that's one of the diseases these days that are talked about more than any other diseases, by the way, but it's still something that's very difficult. This is chronic pain for women. This is so tough. There are so many women out there who can't work, and once a month they have agony and pain. Very important to tell you now, when you become a midwife and you are at the helsestasjon for young people, please, if they have extreme menstrual pain, refer them to a gynecologist. And it sounds crazy, but if you give them the oral contraceptive pill, or even indeed a hormonal IUD, that might help them so much, and might even not cure them, but might help them through. What is endometriosis? Well, it's a retrograde bleed that comes into the abdominal cavity, and as you can see here now, it's a bulge of blood and adhesions because of this. So it creates some sort of inflammation, and this inflammation makes it really, really painful. So every time they're going to menstruate, they sort of menstruate intra-abdominally as well. These endometriosis patches can also fasten to, as you see here, the intestine, and at the end of the picture that way, you will see what's called endometrioma, which is also called a chocolate cyst, which is just full of menstrual blood. All right, so it's important to treat these women early. We see about 10% of all women have this, and 25% of all women with pain, chronic pain, has this as well. When we look at infertile women, about 40% of them will have endometriosis. So how do we treat them? Now, treating is often done, we treat them with, as I told you, the hormonal introduction device, now, or even the oral contraceptive pill. If you have really bad endometriosis, you might even turn off all the hormones for the women and put them into menopause to actually reduce all inflammation. We do also do quite a lot of surgery, and of course, if endometriosis even goes to the intestine or the bladder, we might need to do quite big surgical removal for these women. Some women are so distressed with this awful disease, but please refer them to a specialist as soon as possible. Adenomyosis is sort of the new kid on the block. It's of course always been there, but it's talked about way more than when I started. So when I started almost 20 years ago, nobody really talked about adenomyosis. What is adenomyosis? It's pretty much the same. It's endometriosis in the myometrium, meaning that the endometrial tissue goes into the myometrium. So every time you have a menstruation, or even a few days before your bleed, you will have agonizing pain, okay? And dyspareunia, meaning pain on sexual intercourse, is often seen as adenomyosis. So it's really, really important to refer these patients as well as soon as possible. Even when they're 15 and they start their bleeds, it's not okay to just give ibuprofen and tell the 15-year-old to skip their gymnastics. You have to refer them to a specialist and hopefully get them on hormones to reduce this. So that's a little bit about bleed and pain for women and indeed girls. So please remember always to refer to a specialist if this is the problem. Thank you so much.